everyone. I am Dr. K. Subramanyam, Professor of Cardiology, Sri Jayadeva Institute of Cardiovascular Sciences and Research, Malleshwaram. I will be speaking a few words about the prevention of coronary artery disease. In the recent time, there is an increase in the incidence of coronary artery disease. Both the young and older people are being affected. In such patients, we have two groups of risk factors. One is modifiable and one more is non-modifiable. Coming to the modifiable risk factors, first and foremost we have is diabetes. Next comes the hypertension. Next comes the hypercholesterolemia. Next comes the tobacco chewing and sedentary life and consumption of the junk food. In non-modifiable risk factors, we have the family history, like if the parents are affected, definitely the kids will be affected by this ischemic heart disease. Next comes the history of hypercholesterolemia, which is mainly due to familial dyslipidemia, and also associated risk factors like diabetes and hypertension, which runs in families. These are the few risk factors which contribute to the increased incidence of the coronary artery disease. Then coming to the symptoms, typically there will be history of sudden onset of chest pain. It will be retrosternal and sometimes radiating to the left arm, forearm. Sometimes it will be associated with the profuse sweating and vomiting. Other associated symptoms will be breathlessness, palpitation and fatigue and so on. So this condition, like acute coronary syndrome or common words, we call it as heart attack. It can be diagnosed by some of the few simple tests, that is ECG and echocardiography. ECG is not available in each and every clinic. Only the specialists and the hospitals will be having this, and it is definitely whenever a patient gives the history of chest pain, it is almost always recommended to do the ECG. If at all there is any abnormality, the treating physician or the cardiologist will guide you for the treatment. Treatment comes in mainly two aspects. It is not based on the OPD treatment. The patient should be admitted to the ICU and he should be treated either with lytic treatment or with the coronary angioplasty. And coming to the few words about the prevention of coronary artery disease. First and foremost is we need to control the risk factors, as already I mentioned, like diabetes, hypertension, hypercholesterolemia, like that, and consumption of healthy foods, and also consumption of fruits and vegetables. Then daily walking, at least 45 minutes to 1 hour in a day. And this comes to the prevention of coronary artery disease. And also nowadays we are doing a lot of preventive health checkup camps and all, so much so that around 30 to 40 years of individuals they can undergo a master health checkup, which includes fasting sugar, lipid profile, urea, creatinine, complete blood count, thyroid function test. And next comes a special test like ECG, echocardiogram and TMT. If any abnormalities are there in such tests, then the treating physician or the cardiologist will guide them. Doing all these things, definitely we can reduce the incidence of coronary artery disease. Thank you.